Joining us today are three remarkable individuals who are living proof of what is possible. Lizzy Craze, a heart and kidney recipient, Kristin Hunt, a kidney recipient, and Daisy Friedman, a multivisceral recipient. We are so grateful to each of them for sharing their stories and with our community today. And our moderator for this session is Madelyn Flickinger, someone we are so proud to have with us, and she will take a moment to introduce herself. Here's how this session will work. You'll see a short vignette of each of their journeys, followed by a live interactive Q&A. Go ahead and have your questions ready. You can post them at any time during the talk. We want to hear from you. We know you have many options for where you could spend your time today, and we are truly grateful you're spending some of it with us. Welcome, enjoy, and thank you for being with us today.
I can't believe how good I feel. Those were the first words I said after I received my kidney transplant 31 years ago. I am Kristin Sheffield Hunt, and I am number 62, as in I was the 62nd pediatric transplant at Johns Hopkins Hospital. As of January 31st, 2026, they are at 358. Shout out to Dr. New, thank you. At 15, my kidneys failed rather quickly, with the diagnosis of membranous nephritis on top of interstitial nephritis. I received a kidney from a deceased donor in November 1994, and I'm proud and excited to be here today, sharing a little piece of my story with you. After my transplant, life threw me a few curveballs, including pulmonary embolisms, native renal cell carcinoma, intracranial hypertension, atrial septal defect, and the ever-dreaded rejection. However, I also graduated college, married my best friend, had my miracle baby, swam with dolphins and sharks, learned to scuba dive, I snow ski, exercise, travel, and overall live and love my life. My experience has afforded me the opportunity to nurture, educate, and support other transplant recipients. Since my transplant, I have worked with the Improving Renal Outcomes Collaborative, Transplant Families, National Kidney Foundation, Living Legacy Foundation, Team Maryland, and the Transplant Recipients International Organization. In addition, I run the leadership program at Johns Hopkins Camp All-Stars to advocate for adolescent and young adult transplant patients. For those of you starting your transplant journey, I hope you see this panel of transplant recipients and know that you too can thrive. The advice I would give to anyone in this journey is to drink the water, take the meds, get the labs, and listen to your team, and know that they are there to help you thrive.
All right. Hello, everybody. My name is Daisy Friedman, and I am a multivisceral organ transplant recipient. I had a liver, small intestine, pancreas transplant in 2006, and I'm going to be telling you a little bit about my journey. Okay, so I was born with something called gastroschisis on February 8th, 2003, in New York City. And what gastroschisis is it's a condition where your intestines develop outside your body. So very shortly after birth, I had surgery to remove a large part of my intestines that were necrotic or not working, which left me with something called short gut syndrome, which is what a lot of people can have that have either intestinal damage or completely don't have a large part of their intestines. But because of that, I didn't eat for a very long time, starting from when I was born. So I was put on tube feeds, and I completely rejected the tube feeds. And so I was given tube feeds, which did not agree with my digestive tract. So I got put on something called TPN. And at the time, TPN was very, very new. It's called total parenteral nutrition. And it is a mixture. It's a liquid and it's a mixture of vitamins and minerals and also lipids. And it was very, very, very new at the time at the center in New York that I was being seen, being treated. And my parents weren't really sold on the idea of it being given to me because it was so new and it was so fatty. But the doctors were like, no, it's fine. Don't worry about it. And I started to get sicker and sicker. And as it turned out, the TPN was putting me into liver failure. So then not only was I having problems with my intestines, but I was having problems with my liver. So my parents looked all over the country and they heard of a center in Omaha, Nebraska that did intestinal rehab. They had a very, very good IRP or intestinal rehab program. So we picked up all of our things in New York and we left to go to Omaha, Nebraska for what we thought was going to be about a month long treatment plan stage where they would give us a treatment plan, tell us everything we had to do at home, and then send us back home and everything would be okay. But that is in fact not what happened. So after doing my evaluation at Nebraska Medicine, it was very, very clear I wasn't tolerating the feeds, I wasn't responding to any of the treatments, and that I would need not only an intestinal transplant, but a liver transplant, because at the time, my liver had failed because of that TPN. So on July 20th, 2006, when I was 3 years old, I had a small bowel liver pancreas transplant at Nebraska Medicine, at the time known as University of Nebraska Medicine. And after transplant, it was very touch and go. I was diagnosed with PTLD, which is called post-transplant lymphoma. But after a year, that was resolved. I was in remission. And we were sort of expecting to have sort of dire consequences after that. So many people get chronic bouts of rejection, long-term rejection. They have to have one or two more transplants. But knock on wood, I am very, very grateful to say that I have had no rejection. I've had no complications, and I'm on 1 milligram of Prograf, which, if people don't know, is the name brand of tacrolimus. I'm on 1 milligram of Prograf twice a day, and I get labs at my new center in New York City every 2 months. And outside of that, I get to live kind of a normal life, which is really wild and is not lost on me how rare that is for any transplant patient, let alone a multivisceral transplant patient. So I feel incredibly grateful, and I've sort of used this, what we call the gift of life. I know it can be sort of a contentious statement, at least for me, but I've sort of used this gift that I've been given to give back to my community. So since going to college, I have sort of used my identity as a multi-organ transplant recipient to create art about illness, about disability, about normalizing these things, about making them cool, about making them weird and strange and sexy, and giving people the opportunity to learn about us and learn about our lives instead of be, kind of scared or uncomfortable. And I started this advocacy journey when I was a freshman in college. I was attending UCLA, and there was a kind of act that went out to the students, or a statement rather, that all of the students during COVID in like early 2022, I believe, would not be going back to online classes during the Omicron surge of COVID, that everything would be going in person instead. And the Disabled Student Union held a protest. And I was not at all interested at first. I was really, honestly, anti-transplant advocacy for myself. I wanted to be normal, and I wanted no one to know that this was something that had happened in my life. And then this protest happened, and something in me felt very moved to go. And so I went, and I went for a few hours that night, and then it turned into a sit-in. It turned into a 16-day sit-in. And I was completely changed that over that course of time, it was 16 days. And I started to identify much more with my identity as a transplant recipient, with the disabled community. And from there, I started creating movies about this. And my most recent film, Unholy, which is about a girl who goes to her family's Passover Seder for the first time since being put on a feeding tube for a chronic illness. That film went to not only the Sundance Film Festival, which you'll see here, but also South by Southwest, which, if you don't know, are the two biggest film festivals in the world. No, in the country, rather, maybe the third or fourth in the world. And yeah, at this point in my life, everything I have done is in the name of positive transplant representation, positive representation of chronic illness and disability, because our lives are so much bigger and more beautiful and richer than anyone, I think, gives us credit for. And so because of this journey, because of this gift of life, because of my multivisceral transplant, I'm able to do all of these things and serve my community in kind of the only way I know how, through art and through advocacy. And thank you so much for giving me the opportunity to share my story, and I hope you have a wonderful rest of the conference.
Hey everyone, I'm Lizzy Craze. I'm a heart recipient. I've had my heart for 41 years. I'm also a living donor kidney recipient, and my 28th kidney anniversary is this April. I received my heart transplant at the age of 2. I had 4 siblings. 3 of my siblings died as toddlers due to heart failure. My surviving brother Andy made it to age 15 before he went into heart failure. By the very late 1970s, heart transplants had finally started becoming successful. Andy was transplanted at Stanford as an adult, and shortly after his transplant, I started showing signs of heart failure as well. Andy was my biggest champion. He had seen 3 of his siblings die, but he was still alive because of his transplanted heart. And just the chance of me getting the transplant was better than the alternative. Ethics committees were formed to debate on my behalf the life-changing decision of transplanting a toddler, since I was only 2 at the time. But in the end, I was listed and I received my heart in October 1984. I had a fairly normal childhood despite all this. I had friends, I had sleepovers, I went to summer camp, I got in trouble, I drove my mom crazy. But in 1997, my kidney started to fail because of the cyclosporin that I was on for the heart. In 1998, at age 16, I also had the kidney transplant, and my dad was my donor. When I was transitioning from pediatrics to adult, 2 of the kidney peds nurses took me aside and said, "Your mom has been handling everything for you up until now. You need to get your driver's license and you need to be able to sort your own meds." It's clearly stuck with me all of these years. And I realized that survival wasn't enough, that I also needed independence. I met my husband, Jeff, and we got engaged on a backpacking trip in Yosemite. And we went on our honeymoon. It was a safari in Tanzania. And over the years, my family has done genetic testing, but they never found anything. But about 10 years ago, the Stanford Cardiovascular Genetics team reached out to see if we would be interested in doing testing again. And we did. And they finally think they found the gene that caused all of our heart problems. Despite all the good things happening in life, there were hard times too. In 2016, we lost my brother Andy to esophageal cancer. About a year or so later, at a wedding after party, what started as a joke then became a life-changing conversation. A friend of mine from college drunkenly offered her uterus to anyone in our friend group who needed it. We all laughed, but after Andy died, I realized that someday soonish, I would be the last Craze standing. So my husband and I did some talking, and we agreed to try to have a kid. Within a day of me switching meds so that I could get pregnant, I had a severe allergic reaction to the new med that they put me on. I called my heart clinic right away and they got me off of it. But this was a wake-up call for me and for Jeff that many things could possibly go very wrong. And this is when we decided to use a surrogate. I asked my friend Alicia if she had meant what she said back at that wedding after party about her uterus being available. And she said that she did, but if we were serious, she would check with her husband too, since it affects him. And about a week or so later, I was out on a run and I got a text from Alicia with a picture of an old oven that said, "Let's see if this oven still works to bake your bun." We did 2 cycles of IVF and got 4 embryos that fertilized. we tested the 4 embryos for the heart gene and found that we had 1 genetically unaffected embryo. So we put our 1 egg in our 1 basket and it stuck. And 8 months later, COVID was making an appearance. If you remember March 2020, you will remember that no one knew what was going on. The guidelines were changing daily. And Jeff and I drove 6 hours on empty roads to Southern California to where Alicia would have the baby. I was so nervous and anxious going into the hospital. I called my heart clinic and I said, how stupid of an idea is this? And my nurse coordinator told me, we're not going to tell you not to go. This is your baby being born, but you're aware of the risk. Wear a mask, don't touch anything, and wash your hands. The morning of the induction, the hospital told us only 1 person would be allowed in. I was Alicia's support person in the hospital with her. Our husbands were on Zoom while our son Elliot was born the next morning, quite large and very healthy. The in-between years have been extremely challenging, not only because we had a new baby, but we were also still managing being the ongoing pandemic and being a high-risk family. Anyone who has ever interacted with a small child knows that they're absolute germ factories. Elliot's now 6 years old, and sometimes I can't believe that he's real and that everything worked. He has endless energy, loves trains, monster trucks, riding his bike with me when I go on runs, and climbing to the absolute top of the absolute highest thing he can find. Since my transplant, I've traveled to 18 different countries, 49 out of the 50 US states. I've run more than 30 half marathons and 7 full marathons. I don't say this to brag, I say it because none of this was expected to be possible when I was 2 years old. Last year was probably my lowest health year in a very long while. In March, I ran the LA Marathon. And in July, I got the parasite Cryptosporidium. We are not sure how I got it. I was hospitalized 3 separate times, once in the ICU for septic shock. I am still working on gaining back the muscle and weight that I lost during those months. It was a reminder that even decades out, being immunosuppressed means ordinary infections can become life-threatening very fast. I'm finally turning a corner, and I gave myself the goal. I registered for the triathlon at the Transplant Games, which are in Denver this summer. And I say all of this to say that it's possible to live a very full life as a transplant recipient, even if there are setbacks due to complications or immunosuppressant vulnerability. And when there are setbacks, try not to compare yourself or your child's journey to others. Everyone is running their own race. And for transplant families, that race is long, rarely linear, and often unpredictable, but it's still worth running. Thank you very much.
Morning, everyone. Thank you for joining our live first session of the day. We're celebrating long-term survivorship in pediatric transplant. My name is Madelyn Flickinger. I'm a pediatric liver transplant recipient. I received my liver whenever I was 17 years old, so I'll celebrate 6 years in June. I'm really excited to start our day with our incredible stories of our 3 panelists. Please welcome Kristin, who's 32 years post-kidney transplant, Daisy, who's 19 years post-multivis transplant, and Lizzy, who's 41 years post-heart transplant and 28 years post-kidney transplant. Thank you guys for coming on today. I know as a recipient myself, I'm really excited to hear what you guys have to say about being so long out. For our audience, if you guys have any questions, please feel free to put them in the question and answers. If we don't get to them, we'll have our panelists answer them offline, and transplant families will post them in their blog and newsletter. But to get started today, I want to ask Daisy and Lizzy. I know you guys were both really young whenever you were transplanted. Daisy, you were 3, and Lizzy, you were 2 whenever you received your heart transplant. Can you speak to what it was like growing up as a transplant recipient? I know there's things you have to learn, like taking your medications and growing comfortable with your own transplant story, managing your medical appointments while balancing life, and the things that help you both achieve what you described as a rather normal childhood. Can you speak to that?
Do you want to go first?
First, yeah, sure. Yeah, I mean, it's interesting. Like, I think it's, it's all we've ever grown up with, and so I think it's hard to know what it would be if it were different. I think my biggest challenge, not that that was exactly the question, was sort of trying to remember my own story and my own life, and like having it feel very much like it was my parents' experience for a very, very long period of time. I think honestly, until maybe I went to college, like I wasn't really able to identify with transplant. Like I
I knew obviously there are all these things that had happened when I was so young. And I could see, all the markings on my body, and I would go to appointments and get labs and, all the things, take my meds. But like, I also grew up in the Midwest, and I think I like just had this conditioning that I needed to be normal as possible. And I think it really forced me to distance myself from it and really allow my parents to take over that identification of transplant and of like illness and medical complication. And I think at the time it served me well. I think as a measure of self-preservation, I think it was helpful. But I think as I got older and like started to really cope with the idea, like, oh, I don't remember anything about my life before I was like 10. And it's really deeply unsettling feeling for me. And it always has been. And I think, just my story, I think that is something that really pushed me to want to write and want to be a to kind of write. To my parents' credit, I think they really tried to foster a level of normalcy for me. I think I just grew up thinking that going to appointments and like getting labs every month was super cool and normal. And I think like people would look at me on the street when I was in high school if I had a crop top on because I had all my scars. And sometimes my parents would be like, my mom would be so silly. She'd be like, oh my God, they're just checking you out. Like, which is so not true. But I think I think it really did kind of give me this sense of the things I had experienced were normal, which like I had said, went from being a very kind of, good thing to kind of something that was a bit more difficult to deal with. But I think doing the hard work as an adolescent to kind of try to educate myself, talk to my parents, talk to my team about like what really did happen and kind of internalize it and metabolize it and take out kind of the beauty and the vulnerability and the like compassion for like my younger self was sort of how I feel like I've been able to make it to today to live a more productive life. But yes, those are my thoughts.
My answer is pretty similar. It's all I've ever known. So it's just what I grew up with. When I was 7, we moved to a street it was like a cul-de-sac, and I'm trying to count. I think it had at least 12 boys on it that were all around my age. And so I spent my childhood, climbing trees and like literally playing in the mud. And I don't know. My mom managed a lot of my care up until I was like 16, 17, 18 when I went off to college. And the kidney nurses kind of took me aside and they were like, you need to get your driver's license and you need to start learning your own meds and sorting your own meds and all that. I don't know. Something from my childhood that I remember is anytime I was exposed to chickenpox, I always had to go in and get this extremely painful shot I don't even know what it was, but it was I think it was some version of like the titers. And whenever somebody in my class got chickenpox, I was always mad at them because I would have to go get this very painful shot. And now they have a chickenpox vaccine. So I don't know. It's all I've ever known.
That makes sense. Obviously, I was transplanted much older, so that's a different experience than what I had. But I know, Kristin, you were diagnosed and transplanted whenever you were a teenager. Can you speak to kind of the different perspective that you have with that in a really critical time in your life, whenever you're talking about like school transitions and possibly even getting jobs or having different types of relationships? How did transplant impact that time period for you?
So for me, it was rather tricky. I gained a lot of weight and had some issues with, breaking out with some of the medications and having a puffy face. So it was very obvious from the outside that something was going on. So it was something I kind of had to address with all my classmates because it was so obvious. I was very fortunate in that I had a very strong support system, and my parents kind of took this is what we're going to do and everything's going to be fine. And I believed them wholeheartedly. And so I just took the meds and went to the appointments and did whatever I was told to do, thinking everything would be fine. And luckily enough, it is. But I think having some really good friends that were able to not exactly understand, but sympathize with what I was going through and just kind of be by my side in the school and talk to other people in school was really very helpful. Um, it is kind of a critical time in your life. And so instead of my mom taking over all my meds, I did all my meds. But of course, your mom is there every day asking, did you take your meds? Did you take your meds? And she still does it to this day. But I was just really fortunate with the support group I have to really help me get through that period.
That's really important. I think support is one of those things that transplant centers look for and they talk about, especially going into transplantation. But once the transplant happens, and especially as you get further out, I think it's kind of an under-recognized and undervalued topic. It sounds like you all had the support of your parents whenever you were younger. And Lizzy, I know that your brother played a big role as well in your story. How has that support kind of evolved and changed as you guys have grown up? I know Kristin and Lizzy, you guys are married. How do your spouses kind of support and embrace your health? And then Daisy, I know that you're active kind of in the adolescent and young adult transplant community. That's where we've overlapped before. So if you could speak to kind of the importance of finding a community with shared experiences, that would be great. Whoever wants to go first.
I can go first again. Yeah, I mean, it's been really interesting. I think community is something I've always searched for really, really hard. And yeah, my parents have been an incredible support system. I think, parents are tough, just as Kristin was saying, like my mom also, granted, I'm a bit younger and a bit less far out, but my mom also asked me if I have taken my meds every day and it's really on me. And, I really appreciate it. And also, as a young adult person, it can be really challenging to sort of differentiate, especially when so much of my identity and my parents' identity has been so linked to transplant. It's like been a very difficult differentiation process between, especially my mom and I. And I think that I can always count on her, and I know she will always be there. And I think it has put a little bit of a wrench, maybe is the word, in our relationship, just because I think autonomy is one of the things I seek the most as a young adult transplant recipient, and it's really hard. And sometimes you can't achieve that, and sometimes your health doesn't allow you to. But I think that's something that, in terms of support and like the parental relationship and how that relationship shifts over time as a young adult, is something I think about a lot and it's very important to me. But in terms of the other support, yeah, I mean, I've been in pursuit of community, of transplant community, of health community in general for a really long time. And to be honest, I actually don't know if I feel like I've totally found it. And Maddie and I, we can talk about this another time as well. But like, I've really tried to tap into like the disability and chronic illness community in the film universe. And like that doesn't even feel totally right. And sometimes I try to tap into the young adult transplant community. And, that doesn't always feel totally right because I'm so far out. And so many people who are in those spaces who need that direct support aren't. And then I sort of fall into this space of almost being kind of like a grandmother type of being like, don't worry, you too will get there eventually. And I think like I struggled to feel supported in some of those spaces because it is such a not guaranteed thing to be 20 years, almost 20 years out, to be multivisceral, like to be all these things. Like it's almost not to be negative, but like it is almost counterintuitive sometimes to be in those spaces because you're like exposed time and time again to people who are in very critical states of their transplant journey and who are in very tumultuous times in a way that I'm just not anymore, thank God. But I think being in spaces like this, I feel really grateful because I always am in constant pursuit sort of people I can really kind of like let go in front of. And I'm really curious to hear about the your spouses, Lizzy and Kristin, because this is something I also think about a lot as a 23-year-old who like, just got a new boyfriend and like all these things about like how to navigate that and what that means. But I think something I
hopeful in part is like to never give up on trying to find community, because like I haven't. And again, that's also partially why I've been trying to make the work I do to find community and to search for that. But it's hard. It's not always easy. Yeah.
No, that's a great answer. I think finding your community is a very difficult thing to do. Even whenever the transplant community does exist, trying to find your spot in that community is difficult. But Lizzy and Kristin, do you want to add to that?
I just wanted to say, yeah, my mom died in 2020, but up until the very end, she was like, "Do you want me to come in your?" I'd mentioned I had a doctor's appointment, and she'd be like, "Do you want me to come with you?" And I'm like, "No, I'm in my 40s. I'm fine." My husband's been really good. I don't know. I feel like I lucked out. He has never seen me like really, really, really sick. I know I mentioned I had cryptosporidium for about 6 months last year, and that he was really worried about me. My little community, I was on just a trip for fun to Chicago with a friend when I like got sick, and her husband met us at the airport, drove me to the ER, and they texted my husband, and he came and met up with them, and it was just really great. They were both in the lobby. They told me later they were both like, "She's my person. She's my person." And so I feel really supported. I don't know. I'm an introvert, but I'm also a joiner. I just like join and try things. And I always feel like I've had a really great, solid friend group where I can be my whole self. And I think that's just, yeah, it's been great.
So I was transplanted obviously well before I met my husband. And I remember the first time I was hospitalized with a kidney infection, I wouldn't let him come and see me because he wasn't part of my support system and it wasn't part of my routine. And then eventually I caved and let him in, and he has become a key member of my support system. And he may not know all the meds I'm on, and he may not understand all the lingo, but he's always right there by my side, ready to, pack up meds for a week away or ready to get refills and such. And he supports me in a different way than my parents. They are very, well, you have to do this, get it together, like, let's go. And he understands more yes, sometimes this sucks, and that's going to be what it is, but we're going to get over it and we'll get through it. And I would say, your spouse is the one family member you get to pick. You got to do a good job because, when things hit the fan, as they will, you need someone who can really support you and can pick you up and can carry things. And I'm very fortunate in that I found that in my husband.
No, that's really sweet. And I'm glad that he's able to say, yeah, sometimes this sucks because sometimes life as a transplant recipient does suck. Speaking of things that sometimes suck, there are obviously things you have to keep up with, like labs, medications, appointments, all of that. Could you possibly speak to some of the factors that have allowed you to keep up with all of those things and allowed you to kind of persevere and thrive post-transplant? Because as we all know, those things can kind of become overbearing and overwhelming in a lot of different ways. So, any tips or tricks for anybody, even myself, would be would be appreciated. I obviously am striving to make it just as long as you guys have.
Guess I can go first. I personally use a calendar feature to remind me of all the things I need, and I try to schedule appointments far out and many on one day, so I don't have to take as many sick days from work. But I definitely have a calendar that alerts my phone to alert me that, on Saturday I need to get blood drawn so I can prepare for it and not miss a blood lab. Because if I remember it on my own, I will forget and go 6 weeks and not have my blood drawn. So I definitely cheat and use a calendar for pretty much everything.
I do the same thing. If my Apple Calendar got destroyed somehow, I would literally not be able to function. So,
Yeah, same. I have an app, to remind me to take meds. And I use it for my daily meds, but also for like if I'm on a new antibiotic that I have to take at weird times, like 4 times a day. And it has a very loud, persistent alarm that goes off. And yeah, calendaring. I get my meds through PillPack, and so they pre-sort it for me. That was the bane of my existence, having to sort my meds for so many years. My husband did help me because he knew how much I hated it, and I've been using PillPack for like, I don't know, 6 years, and I never want to go back.
Yeah, I mean, I think the same things, calendar,
medicine reminders. Those are hard though. Sometimes I'll like set it and then be like, wait, but did I take it? I like have a weird system. You'll actually see right here. When it's done, I flip it over. When I've taken it, I flip it over so that I know that I've taken it, because there have been multiple days where I just take it twice and that's not great. And I wouldn't do that. And I think like really having a level of calm about it all. Easier said than done, but like I think just knowing that you know what to do, and that, or your caregiver knows what to do, and that like the rest is like you can't control it. And that's the hardest thing. And I say that and I like spiral every 6 days about all the things I can't control, especially being such a, long-term recipient. But I really think so much of it is a positive attitude. And I would like to consider myself a pretty energetic, pretty happy person most of the time. And I think that disposition actually really has come from transplant and from sort of having no other choice in some ways. Because, like, if you succumb to the darkness, then it's just not good for you or for anyone. And I think, yeah, allowing yourself to put any negative energy you have, because it's important to feel your feelings, but to put those feelings towards something that you can look forward to or that you can be productive at. I don't know if I love that word, but like being on top of your meds, or like advocating or doing something that feels like it's nourishing to your soul, because this is like can be a really heavy experience. And I think balancing that heaviness with light in whatever way you can, like, really, I think has been my key to doing this for as long as I have.
I think those are all great pieces of advice. Lizzy, we have a question specifically for you from another heart transplant recipient. Could you talk about any fears of rejections that you have being so far out from your heart transplant? Is that something that you still worry about, or does that concern kind of go away as you get further out?
I have no fear about rejection. I don't think it's going to happen this far out. I have had a couple of rejection episodes because, we've talked about our moms and their, record keeping. My mom had a handwritten note that every time I had a biopsy, she would write the results on it. And so I have had rejection here and there in the early days, but I haven't had it in forever. I haven't had a biopsy in like 10 years. Yeah, so I'm doing good. I think there's some other questions too that I can hit. Sorry, I don't want to take your job, but I remember going to summer camp as a kid. I don't know when I started it, but I, have memories of being, I don't even know, like 8 or 10 at summer camp, and then just like, all through life. And then another one about jobs that you all can jump in on too. My careers have always been very, accommodating. I've never had to miss like more than a couple of days. Like early on I got like food poisoning and I was out for like 3 days. But I think generally people think you're like pretty awesome to have survived, this long, and they're willing to work with you.
That's been my experience too. In the limited time that I have been post-transplant and with a job, I think most people are like, yo, if you survived that, yeah, it's okay. Kristin, I know you, I think, still volunteer with a summer camp, right? Do you want to speak to that question about summer camp?
Absolutely. So kidney camp was just last weekend, and we have kids that are on dialysis, some kids that are transplanted, a variety of mix. And we do push a lot of hand sanitizer, a lot of drinking fluids. We try the best we can to not get kids sick, but it does happen, unfortunately. The camps, our camp runs from 8 to 22, and we have kids that come back at 23 and they're like, but can I still come? I still really want to come. So I think it's a really important thing for your kids to do. They get great experiences out of it, especially if you can find like Camp Sunshine or a transplant camp. It just gives them a cohort of people. When I'm at kidney camp, we're around the fire and everyone's talking about their kidney. Like, it's just a wonderful thing to have other people that you can talk to about this kind of traumatic event that has gone through in your life. And I will just touch base on the employers. I work at Hopkins, so most of the people I work with are doctors and get that transplants are, fully functioning individuals. But I will say, when I first started, I have a scar down my chest. I always kept it hidden. I didn't let anyone know until I was kind of established. And then, then when you have to take a lot of doctor's appointments, it's not like a sudden shock, you've been there for a while, they expect you to take appointments. And then I slowly kind of work my information in. So it's not like, hey, you're hiring me and I'm going to be out a lot because I'm a transplant recipient. It's more like, I've been with you for a year, you know how I am. So that has been my strategy. But most of my employers have been very accommodating, very happy to, let me work from the hospital if need be, or even before COVID. So, I think it's important to get in a good place where they can be understanding. But for the most part, people have been very understanding.
That's great. And I think that's great advice too. I think a lot of people don't know how to navigate that kind of transition, especially into the workforce. Um, Especially with school too. I know they're being sick and trying to figure that out has been a problem for myself, and I know probably impacted you as well. Does anybody want to speak to kind of navigating school
I can
as a
speak to
recipient?
that, but first I kind of want to mention something about summer camp.
Oh yeah, sorry.
Any parent, no, is that okay?
Yeah, go for it.
Okay. Any parent out there, send your kid to summer camp. Like, I don't care what summer camp, send your kid to summer camp. Summer camp changed my whole life. It wasn't a transplant camp. I do think those are incredibly important though. But like, I went to a summer camp for 6 years from like 10-ish to 16, 17. And it was like the first time I realized I could be an autonomous person. And like, I had the ability to take care of myself. I mean, with help of nurses and with help of the support staff and the counselors, but like, I really gained a sense of autonomy there that like there was no possible way for me to feel at home. And like, I was able to really flourish into a person outside of transplant and outside of my health, especially because like I started going to summer camp right at the time where I was just sort of coming out of the woods of everything surrounding my transplant. Maybe a few years earlier, but still just like, cleaning up all the loose threads of that. And yeah, I like really felt like I became a person at summer camp. I went to Jewish summer camp for 6 years, and that is its a whole universe in and of itself. But yeah, I mean, I still talk to all my camp friends. I don't know. I think going to like a transplant camp. I went to a cancer camp before because I had PTLD, and that was a good experience, I think. But I think having both was just really formative to my identity. Anyway, school. So I started school during COVID. So my freshman year of college was 2021, and that was really scary. And I also went to UCLA, which is one of the biggest public universities in the country. So super duper scary. There was a time during COVID when the chancellor of the school put out a statement that basically said if you're too medically vulnerable to come to class, you should take a leave of absence because they weren't going to do online classes in the fall of winter of 2022. And so I freaked out and ended up kind of doing a big advocacy push with a group of disabled students to change that rule. It didn't end up getting changed, but then the entire school ended up going online because the COVID numbers were so bad, but it was really intense. I had to like wear a mask to class when none of my peers were, which felt like really devastating at the time, even though at the time it's like really silly and everyone should have been doing it. I ended up moving into a single room in the middle of the semester, which was really challenging. And I really felt like nobody was like hearing me or listening to me, and that people were really moving on, even so early in the pandemic. But I think we were all freshmen in college, and everyone just wanted to party and be free after all the years of not being free. And I really wanted to participate in that, and it made my freshman year really, really hard and devastating. But I think the biggest thing I learned from that experience is just consistently advocating for yourself and like making sure to get your needs met, and also to be accountable for yourself, to know that I might not want to wear a mask. I might forget to wash my hands, but like this is actually like could be a life or death scenario. And I think going through that experience like gave me more made me feel more like I could stand my ground as an advocate for myself, and I could trust myself as a patient to look after myself in a way that I don't know if I would have felt had that not happened.
Okay, I think for our last question, we're going to answer the one about donor families. Have any of you been able to contact your donor families? I know, Lizzy, your kidney transplant was living donor, but your heart transplant was a deceased donor. Has anybody been able to reach out or even meet their donor families?
I have reached out to my donor family. I wrote a letter, but I haven't heard back. But I would encourage people to. I know a lot of people that have really great relationships with their donor families. And I think it's an amazing thing. Although I completely understand donor families that, don't want any interaction at all. I'm extremely thankful, and I just wanted to express that to the family.
After my heart transplant, my mom reached out to the donor family and did not hear back. I know that she also reached out to my brother's donor family, and they did write back. And we never met, but he ended up needing a second transplant, and they wrote to that family afterwards, and they got a letter back from the donor family like years later, and it was the week that he died of cancer. So I feel like that was something in the universe. I don't know, being university. It was a really warm feeling.
Yeah, I mean, similar. My mom wrote a letter right when I had my transplant. I wrote a letter years later, maybe like 3 or 4 years ago now, and I haven't heard anything. I would really love to, for sure, but I totally understand. And you guys would appreciate this. So I have a tattoo. You can't see it. Oh no, you can't see it. Oh, maybe you can see it a little bit. It's okay. So it says L'chaim, which in Hebrew means to life, and it has a little face outline, and I like made it that way because it's sort of an outline of a face, could be anybody, and so it's supposed to symbolize my donor and anybody who that person might be, so they are always with me. But yeah, maybe it'll happen eventually. Lizzy, you just said years later. Holding out hope, but I can understand why that might not be something that they would want.
I think those are all really great answers. And I think the gratitude that we all feel as recipients is sometimes hard to describe. And being able to write those letters, I think I mean, I've written one myself, um, kind of maybe helps us express that gratitude in a way, but I think we also fully understand, families who it takes multiple years to reach back out, or sometimes we don't hear at all. I think we have understanding of how difficult it probably is, and I think we're just very grateful for the donors and their families for giving us the ability to kind of carry their legacy on with our lives. So that's really impactful. But thank you guys for answering all the questions. I'm sure that you'll be asked a whole bunch of questions offline. I know didn't get to everything, but I think this was a really great session, and I know I learned a ton, and I'm really thankful for your perspectives and your answers. So thank you for joining, guys.
Thank you for having us.
And thank you so much. This was wonderful.